Good afternoon, everybody. My name is Leslie Ann Johnson. Thank you so much for joining us and welcome to this press conference by the Ministry of Health. So let us introduce the team here for us. We have the Honorable Minister for Health, Nickolas, Steele, and to his left, the Acting Commissioner of Police, Edvin Martin, and to his left, the COVID-19 Response Coordinator, Dr. George Mitchell. And of course, we're continuing to update you on COVID-19. So without further ado, I will turn over to the Minister for Health.
Thank you very much. Afternoon to all of your listeners. We endeavor to meet with you as often as possible to give you information in a timely manner. Today, our updates are of the following. I'll get directly to it. We now have the ability, as was announced, the ability to test on island. We started that aggressive or more aggressive testing process as of yesterday. And as we speak, we have 47 samples pending results. We expect to get those results overnight and we'll announce the results of those tomorrow. Those results come from the individuals who were or may have been in contact with our 12 confirmed cases. And a couple of them are individuals who may have shown symptoms that cause some reason for concern to allow the team to do testing. So there are 47 tests pending in the next 24 hours. To give you a comparison, that is more than we have done in the last 3 weeks. So in this last 24-hour period, we have accelerated the testing process because of the ability to get testing results here on island. Most, if not all, of the individuals to date who may have been or were exposed to our initial cases have gone to or all within the next couple of days or so would have completed their 14-day quarantine. This allows us as well to do further testing there. This was one of the reasons why we had the aggressive restriction on movement in the past week and for the week coming. That is to make sure that the status quo, whatever it is, remains as much as possible the same and does not get any worse while we put all of our other systems in place, specifically the ability to test more aggressively, to continue to follow up on what we refer to as contact tracing, also to make sure that every aspect of our isolation unit or ICU unit, COVID ICU unit, is also up and ready. We continue to receive more and more equipment daily, but we do now have the original conversion of the private block and also based on normal conditions, a 10-bed facility as well to deal with COVID patients, which under emergency conditions can be converted into a 14 to 15-bed facility. Just to give another update with respect to our cases at present, when last we gave information to the public, 2 of our 12 cases were in our COVID isolation unit because they needed hospital care based on the symptoms that they had. Regrettably, I have to announce one more of the individuals is now also at that COVID facility because that person is in need of further medical attention or hospital care. So we have 3 of our confirmed cases in hospital right now at our COVID ICU unit. As a result of that, we have moved all patients and the team up to the 10-bed facility. This is the first time that any patient or any of the team would have been occupying that 10-bed facility. I know that there have been malicious comments circulating on Facebook or otherwise. This is the first time that any of the patients or any of the individuals doing the actual treating have occupied that 10-bed facility. Our frontline medical staff continue to provide yeoman service, as well as the Royal Grenada Police Force and other members of the Central Service, and I want to take this opportunity to again thank them and to ask you, individuals of the nation, to also show your appreciation wherever possible. I also want to take this opportunity to thank those who have assisted us in getting to here, the donors and the various individuals who have assisted with equipment and support. St. George's University, Pan American Health Organization, CARFA, WINREF, the People's Republic of China, most definitely, the government and people of Cuba as well, our various ambassadors around the world, but in particular Ambassador Newfield, who has been assisting, and also the government of the Bolivarian Republic of Venezuela. They have been assisting us, and it is because of them that we are at this level of preparedness and ability to deal with the threats that we have. So on closing, I can say that most definitely we are not out of the woods. We still have to be cautious. We still have to be concerned. There is still a significant threat. But if we are all able to maintain as best as possible the confinement, the restricted movements, then it would allow us, it will allow the health team to do the job that is required to ensure, if at all possible, that the only cases that we have identified to date are the only cases that we have. We are waiting, as I said, the 47 for tomorrow, and we will announce that as soon as possible. The Ministry of Health is also endeavoring to have regular press briefings, if at all possible, daily. That is to remove some of the anxiety on the nation when I announce that I have a press briefing, in the hope that you will get accustomed to seeing me on a daily basis and not only when there's bad news. So without having said that, I'll hand over to Commissioner and Dr. Mitchell if they have any other comments, and then to questions from those who are out there. Thank you.
Okay, thank you very much, Minister, and let me take the opportunity to say a pleasant good afternoon to all of Grenada, Carriacou, and Petite Martinique. It's a good press conference to be in, as it is the first time I can report that overnight we only had 2 arrests relating to curfew. That is a massive improvement in the cooperation of members of the public, and I do hope that tomorrow morning we will see 0 arrests because of cooperation. Additionally, overnight, we only had 2 crimes reported, and of a minor nature, I should say as well. So I'm very encouraged by that. I want to use the opportunity here to make a distinction, because I realize that there is a bit of discomfort as it relates to how do we treat with Carriacou on shopping days. Our community relations officer said a lot of stuff as it relates to shopping days in Grenada, but that created some doubt, the fact that we did not specify what will happen in Carriacou and Petite Martinique. And I want to take the opportunity here to state clearly that shopping day in Carriacou and Petite Martinique, the next shopping day will be Tuesday. Tuesday 8 to 4 will be the next shopping day in Carriacou and Petite Martinique, and the Western Union and money remittance there will open also at the same time between the hours of 8 and 1, and shopping will be between 8 and 4. Saturday in Carriacou will also be open for, the gas station will open for essential services between the hours of 8 and midday. So I wanted to clarify that as well. Additionally, I'm pleased to report that we have now activated a cabinet-approved committee called a Central Coordinating Mechanism, which is based at NADMA. So now we have integrated into NADMA and utilizing the NADMA construct a central coordinating mechanism for which all of the activities that are taking place related to COVID-19 will be routed through. That committee is headed by our COVID-19 lead, Dr. Mitchell, supported by myself. We have also created an emergency operation center within that construct that constitute with lead and senior persons from all of the different agencies and departments that is critical in the fight against COVID-19. Much effort has been put into implementing this, and we will have press brief to inform the public exactly how this will be implemented. But generally, from a law enforcement point of view, I think we are doing well, and I want to continue to encourage and appeal for public cooperation as we look to reverse the trend of COVID-19 in Grenada and hopefully to be able to boast, as a matter of fact, that Grenada is turning the tide by the action we are taking. Commendable effort by community cooperation and collaboration with us, and I really look forward to your continued cooperation. Once we join together with this, we can beat this, but we require your constant cooperation in this endeavor. Thank you, and I hand over to Dr. Mitchell.
Thank you very much, Commissioner of Police. I would just like to add where you sort of like left off in saying that we continue to fine-tune our efforts in terms of the response and speak to what we have been doing regarding the establishment of NADMA and the focus at this particular point in time. In our meeting, we charged the entity to look particularly into the psychosocial aspect and mental aspect of the population, concentrating on children, the elderly, mental health patients, as well as persons with special needs. So this grouping with the specialization that we have would develop programs, and I'm talking about innovative programs to reach out to those agrupations, those groups, to ensure that we don't have to reactively deal with issues related to these groups, but we proactively would deal with or as a matter of fact, enact programs that would minimize the effect that this particular situation, this COVID-19, would have on this particular population. So this is for us extremely important. It is proactive. In my view and in the groups, in NADMA's view, it makes a lot of sense. We don't wait for the problems to happen, but we proactively engage with it. So this is basically what I want to say in terms of new development. I think it is very encouraging. Persons have been asking for that, and we've been seeing more and more the need for that to happen. So we are refining this part of our response going forward. I must, Minister, add as well that our workers out there have been really, really heroic, extremely heroic. I can't but take my hands off to our healthcare providers, and at every level, the cleaners and all who are at the front line of this response. They have been doing a more than fantastic job at the moment, and we can't but wait to salute them. I hope that the salutations would even come before we get to the end of this response. But those guys and women have been doing a fantastic job, and I must say kudos to every one of them. Thank you.
Thank you, gentlemen. So we will go now to questions from colleagues. We have one or two, so we'll start right away. Minister, can you talk about the assistance Venezuela may have provided?
Yeah. Venezuela has been providing logistical support. In fact, there is an aircraft that we expect to arrive tomorrow with testing equipment. And they have, this would be the second time that they have been doing that, but they have been providing in general logistical support for us, but not just us, but other islands in the OECS. I know most definitely that support has been offered as well, and continues to be given to Dominica and St. Vincent and some of the other islands. So that in a nutshell has been the assistance, which has been in this last week one of our biggest challenges. A lot of our equipment is procured. We have been fortunate enough to avoid having equipment in the United States still, but in order to get it here, we need to find non-traditional ways, and that is where we thank the government of the Bolivarian Republic of Venezuela.
Dr. Bacheladom, this one might be for you. Somebody's asking if there's a database of information regarding the number of Grenadians in the diaspora who may have died from COVID-19.
The answer to this question is that a database is being developed. I am not sure if each and every person has been captured thus far, but this did come up at our meeting, the need to do that, and our High Commissioner in the UK, together with her colleagues around the diaspora, are working on that, and in a very proactive way as well. They have been reaching out to families who have suffered, regrettably, the loss of loved ones, and I know that some sort of like program, and Minister may want to sort of like develop on it a little bit, is being fashioned so that we can appropriately address this issue.
Yeah, let me add to that in terms of the Ministry of Foreign Affairs and Diaspora Affairs has been as best as possible working on that to stay in touch with all as many of our members in the diaspora. There are some who have been hospitalized, and some who were hospitalized and released, and some who regrettably are no longer with us. The problem there is, as you can imagine, the chaos that's existing right now in those cities where our diaspora live. The deluge of patients that are at various hospitals in New York, in London, and elsewhere is making it difficult, but we are making every effort. Fortunately for us, we are a close-knit community and we keep in touch with each other. So the news comes from various sources, sometimes from our diaspora affairs and our missions abroad, and other times through friends and family in our very own communities. But we are keeping a log and a note and continue to express our condolences to all who have lost loved ones. I think this brings home the fact that while, thank God, to date, no one has died in Grenada from COVID-19, we need to recognize that Grenadians have died from COVID-19, so we have paid a price.
While we know we're doing everything we possibly can here to ensure that people remain healthy, but in terms of medical supplies, are we sufficiently equipped if, God forbid, there should be like an increase in confirmed cases?
The simple answer to that is we are equipped as best as possible. We are seeing first world nations with much larger budgets and much greater capabilities than us crumbling in front of our very eyes. We have made every effort to strengthen our system, and at the same time, I think what has been different is that we have also made an effort to minimize circulation of our population and therefore minimize the possibility of infection. That combination hopefully will work like it has worked in other countries. When you look at, for instance, China, with the size of China's population and the number of cases that China had, compared to other countries which have smaller populations and the number of cases that they have, the one fact is if you can very quickly and very early minimize the circulation of your population and therefore minimize your population's risk to infection in combination with strengthening your health system as best as possible, that is the best approach.
Just let me add that a similar question came up yesterday from someone in the public, and I immediately went to the real source, meaning that I called the medical director to find out what was happening in that realm. And the answer to me was that, Dr. Mitchell, yes, in terms of medication, we do have enough at this time based on our projections in terms of treating patients. So I was absolutely relieved to find out from our medical director that based on our treatment protocol at this time, that they were confident and comfortable with what they had at this time.
Thank you, gentlemen. Sherry and Noel, good afternoon. Go right ahead.
I have a couple of questions. The first I want to pose to Mr. Steele. Minister Steele, I just want to know if you are aware of a survey that is going on in people's email addresses as it relates to the COVID-19.
You're saying a survey that's going around?
Yes, it's a survey. It's COVID-19 index.radius.gd, and it's asking some questions. So trying to figure out if you as the Minister of Health is aware of such a survey.
Not at this point in time. I know that we were looking at doing some stuff on, unless the team, the health team, I know they've been working aggressively, unless they got it out there even before giving Dr. Mitchell and myself the final copy or so, which is a possibility, but at the moment, no. I am not aware of a survey. I would assume between now and before we get off air, we will be able to confirm whether they did enthusiastically release. I have seen a survey that we are going to be doing, and we will give you information on that through our official ministry website.
Okay, my next question, you mentioned that you now have 3 patients in the 10-bed as against COVID. In terms of the present condition, are we seeing signs of recovery?
Well, the last patient to be admitted, it's too early to say. I mean, what we can say is that over the last 24 hours that patient's condition declined. The other 2 patients are stable from the point of view that their condition hasn't worsened. They are stable. It is my sincere hope that we can see their release in a not too distant future. But for the time being, they do need the professional care that our health team is giving them, and they do need to be kept in our thoughts and prayers.
Okay, and I also want to ask you a bit about, I know in the ago we had some Cuban medical professionals here on the island. What are the roles, how things are working out with them in terms of helping with the fight?
The Cuban personnel have been really a godsend and allow our team to be larger as well as more efficient and effective. They are working with our local team and have been providing yeoman service. So we are most grateful to them, and I think that is one of the biggest forms of assistance that we have received from Cuba, because they themselves are under threat and they themselves are fighting the battle. And in the midst of that, they were still able to lend us their very qualified individuals to help us fight the battle against COVID as well.
My next question is for Dr. Mitchell. Dr. Mitchell, during the press conference on Monday, you said that period is a very critical period for us. Yet still, we are still seeing that people still want to go and fill gas and so on. How critical is it as we go through the days? Because you mentioned it's critical, but still we're seeing people are asking, making certain requests, and amendments are being made in this time.
This period is indeed one of the most critical periods in our response, and that is because at the end of this period, because we will be able to, one, do additional testing, and because most of the persons who have been in direct contact with our positive cases would have elapsed their mandatory 14 days, we think that we will get a good grasp of the situation at the end of this period. There are other theories out there that you have a lot of silent carriers, etc., etc., etc. But those are theories, and we cannot negate the importance of them. But we think that come Saturday, thereabout, we would have reached a period where the vast majority, if not everyone, who's been in contact with a positive case would have by then completed 14 days mandatory quarantine, and then we would have been able to test persons who have or been in contact or have responded to those persons. And by doing so, as I say, and I want to repeat, we would get a really, really good appreciation of what we are dealing with. And hence the need and the necessity to ask people to stay home. And I hope people really, really understood. And yes, we have had some not pushbacks, but we have had some queries in terms of what and why is this period and why should I be doing it. This is the reason. We think that if we accomplish this at this time, we will be able to be in a comfort zone, not, of course, being too complacent in terms of our response.
Sherry, that's it for you for time?
Yes, please.
Okay, great. Right, great. So Rachel, you know, and then Mikey will come to you in a second. Rachel, go ahead.
Good afternoon. I have
Just lower your volume. Thank you. Okay, so in the meantime, Rachel, while you get yourself together, Commissioner, any discussions? Somebody's asking if there have been any discussions yet with relates to Carnival 2020.
A very interesting question. We are ready to celebrate, innit? Let us celebrate after we conquer COVID-19. But certainly no discussion as yet. That has not been considered, that there have been no active discussions. But I'm excited that the public is considering this, because if we want Carnival, we have to get rid of COVID-19. So please walk with us, demonstrate the discipline, and let's move forward on it. Thank you.
Thank you, Commissioner. Rachel, are you ready?
Yes, someone actually reached out to me today, so it's interesting that that question and that polemic is out there about Carnival, are we going to have or not? And I love the Commissioner's response. If we're going to have it, then guys, please do what we have to do. Please do what we are asking you to do. Take the necessary measures. All the social distancing measures, all the issue that we have recommended in terms of wearing your face mask, this is the time to do it. Let me just add that the person said to me today that we don't really have to get persons coming from outside. We could have our own little mask. So let's have our own little mask now by doing the right things if we want to have that happen come August, July.
Thank you, Dr. Mitchell. Rachel, go right ahead. Then Mikey, as I said, we'll come to you, and then we'll take a couple questions from the people who are asking online. Go ahead, Rachel.
in MTV News. What measures are in place for the mentally ill in terms of treatment?
Well, Rachel, I'm not sure if you're asking in terms of treatment for COVID or in terms of treatment in general. The facilities for mentally ill, that was one of the first announcements we made with respect to visitation there and to the homes for the elderly as well as the prisons, to make sure that, as we saw in other places, that they didn't become incubators, or so that they were looked after as best as possible but separated from the rest of us so that we couldn't infect them. So mental health, I would say, like most of the other areas in the health system right now, there are challenges dealing with COVID and our ability to respond. But those that are in our facilities receiving treatment have been isolated, and those who are providing the treatment continue to do so.
Let me add that only today as well, and those things are happening just like really in an interesting way. I had a discussion with one of our providers, not for persons who are institutionalized, but someone who attends to those challenged persons on the outside, which is more or less the question I think that Rachel might have been asking. In other words, how do we treat with those persons who are at the community level? And I charged that individual with coming up with innovative programs, innovative ways to reach out to these people. So that is happening. They are going around the country and they are fine-tuning in this period how best to treat with that particular group of persons, because we are in unusual times, and so we have to come up with innovative measures to reach out to that section of the population. I already said in my opening remarks that in addition to our mental health services that we provide on a regular basis through our institution and our outreach program, we are also charging NADMA and that network to ensure that those persons, challenged persons and mentally challenged persons in general, are actually reached out to, because those are critical times.
One more, Rachel? Rachel, you need to turn on your volume. Thank you.
My second question is, have you started, Dr. Mitchell, right? Have you started any hydroxychloroquine trials on any COVID-19 patients?
Rachel, no, we are treating patients. We're not having trials at this time. But I tell you what, all of those treatment protocols would be well documented and taken forward. But no, we're not having trials at this time.
Let me add to that, Rachel. We have made sure from a Ministry of Health standpoint that the doctors and nurses providing the care have all of the tools possible in the toolbox. But it's up to them to decide. And as far as I'm aware, no, they're not doing any trials. But all forms that we have heard about that may be credible or we may want to have in our toolbox, as I say, we've made sure that they are available.
Mikey? Rachel, I'm sorry, you're not finished yet. Okay, I'm not hearing you now.
No, I'm not. Minister Steele, what is the status of the individual who sneaked out of the app? Do you have any information on that?
Dr. Mitchell?
Yes, when you say what is the status, is he all right? Yes, the gentleman is okay. We have been in touch. He has graciously reached out. We've been on WhatsApp. The gentleman is I want to commend him too for sort of like making sure that, you know, there are no undue issues surrounding his departure, and he was very upfront when we asked him about, you know, his whereabouts, etc. So the individual, yes, is okay up to the time I last spoke to him.
Let me just add to that, though. That's Dr. Mitchell's personal opinion with respect to the gentleman. I still have an issue with what he did, and I'm sure the commissioner does.
Okay, Rachel, yeah, just one sec. Let's just get somebody else in for a second. Mikey, go ahead.
Gentlemen, again, I'd like to thank you for the opportunity to ask some questions on behalf of the general public. Let's talk about the 10-bed block for a moment. I understand that the 10-bed block is located at the General Hospital. My question is, are all personnel, tools and utensils that are to be used within that block going to be restricted to that block?
Yeah, Mikey, we keep getting those kind of questions, and yes, that's why it's being referred to as a separate block. That's why we took the time to convert one area, and then also after doing that got another area. But yes, it goes even to the extent that the individuals who are providing service, and I think you need to know that as members of the general public, the individuals who are treating those three patients there now, positive patients, can't even go back to their own homes when on their downtime. That is how much of an effort has been made for separation. But I think you need to, as a public at large, recognize how much of a sacrifice the individuals are making to provide care to those patients.
Okay, thank you for that reassurance. My next question goes to the Commissioner of Police. In terms of the gas day today, what is your assessment of it?
Thank you very much, Mikey. I know there have been a lot of responses as to why a gas day. And then the number of vehicles that we have into the country, I think this created an excellent opportunity for all to get a view as to how significant our population of motor vehicles has grown. And the challenges that our traffic department has in maintaining that. So I hope going forward, let me plug this in, Mikey, I hope that going forward, now that we know the magnitude of vehicles, we will be a little bit more considerate in parking by the roads and causing places where we can obstruct traffic. But I was impressed overall today with the compliance of the motoring public, and I need to say that. By and large, we had a few persons who did not cooperate as intended, but those were in the significant minority. But by and large, persons sat in their vehicles, wait patiently to receive their fuel. And I want to say why I think the committee had to give that permission as well. We must understand in this context, it can have a serious security repercussion if we fail to provide means by which people can have access to food and services when it is critical. One of the issues we were challenged with is that individuals had to move around to be able to access food services because not everyone is close to a shop. We also have to recognize a situation where medical emergencies is a critical factor, and we need to make sure that individuals, should in case anyone has a medical emergency at home, that they do have the ability to move. We recognize over the period of time with the shutdown that some persons were running low on fuel. So the decision was made to facilitate this, cognizant of the fact that when we implement our parish boundaries and our checkpoints on the inside along with our roving patrol, that by the end of that period we can safely get everybody back at home. But more importantly, it also helps persons have the peace of mind that if they have any critical emergency, they also have the ability to respond. I hope that satisfies your question. Thank you.
Just to add to that I know I saw a lot of people circulating on Facebook and other social media, the long lines early this morning, but in general, Commissioner, I think by about 9:30, 10 o'clock, everything was dealt with, and we had given from 8 to 12, but I guess most people came out early in the morning to get to the lines early, so initially they were long lines, but by 9:30, 10 o'clock, everything was working smoothly.
That's it, Mikey?
I'll give my colleagues an opportunity to ask their questions.
All right. Akisha Felix, go ahead.
All right. A pleasant good afternoon to everybody. My first question, you gave an update on the 3 patients in the isolation unit as well as the individual that left the island. Can we get an update on the other patient so far? Another question, well, not a question, but more or less a confirmation. The 47 they're spending. Am I clear enough? Okay.
You want update on the 47? Go ahead. I can hear you.
Akisha, go ahead. Akisha, we're hearing you.
The 47 tests that are pending.
You want more information on the 47?
47 tests pending. Can you confirm that all patients?
I'm not sure I understood the last part. Let me try on the first part of your question.
The 47 tests that are pending. The individuals, are they're in mandatory quarantine as usual?
Yes.
Can you confirm that for me?
Yes, most definitely.
Right, and can I get an update on the infected patients apart from the 3 and the individual that left the island?
All of the other positive patients are not requiring medical attention at the hospital. They are being visited on a regular basis, checked in on as well on a regular basis. But thankfully, none of them are requiring medical attention at this point in time.
All right, Minister, let me just take one or two from... You have another one, Akisha? Okay, go ahead. Go ahead. I don't think she's hearing us well, so let me just ask quickly, in the interest of time. The 47 tested, were any of them retested, or were they all new cases?
These are all 47 new. Dr.
Yes.
Mitchell, you can confirm that.
Yeah, those the 47 tests are actually new. I don't know why I like to come to the mic like that. The 47 tests are actually new tests, and it is interesting. I just wanted to go back to the previous question a little bit in terms of what is the status of those persons who have tested positive. They are doing well. In my last conversations with that particular household, they are all upbeat. They are all almost like ready to go. That's the last thing I heard. They are forever thankful to the medical system, to what we have provided, the amount of times that we have reached out to them. They told me that they are praying for us, that I was very, very thankful for, and they are in high spirits and in high praise of our system and the attendance that we've given them. Just a segue, they have not been tested as yet. To ensure that they are symptom-free at the moment, we are going to do that in the very near future to ensure that they are not in a position to continue transmitting the disease.
Somebody else is asking, how many ventilators do we have at this moment?
We have currently 10 ventilators dedicated to COVID, which is separate from the 4 ventilators that we always had, and we are expecting more over the next couple of days to arrive on island so that we can deal with whatever threats we may have.
Commissioner, somebody's asking about reports of domestic violence since the curfew has started.
Thank you very much. Quite frankly, since the curfew has started, we've had a significant downturn in criminal activity in general. And as indicated before, only last night we only had 2 reports of crime, and separate from that, 2 reports of curfew. It has not been brought to my attention, and I get crime reports every morning. It has not been brought to my attention of any increase in domestic violence of the kind.
Thank you. So let's see, let me stick in another one here. Mr. or Dr. Mitchell, the tests done locally, somebody else is asking, are they still to be verified by CARFA, and what is the accuracy of the tests?
Well, let me say that we worked in conjunction with CARFA and Pan American Health Organization on that. As recently as yesterday, there was communication directly with CARFA and Washington, dealing PAHO headquarters Washington, with our testing. And to go further, the individuals who are doing the tests at WINREF SGU have been involved with CARFA with respect to advisors, etc., or colleagues for years. So these aren't new individuals who are suddenly doing tests here in Grenada. These are individuals who are part of the CARFA network. They may not be at the CARFA headquarters, but they interact and are working with CARFA and have been working with CARFA for years, as well as Pan American Health Organization. So it's just a transition with respect to a machine that they have been working on with for years as well. What is different is the new test kits. So specifically what RNA we are testing for with those machines. That is what is different, but even so, all precautions were taken and every measure was taken to ensure, actually much to my annoyance or impatience, that it took 3 days. The ability was here on island 3 days before, but they made sure and went through systematically a process before they actually started testing.
Great. Sherry? Go ahead, Sherry Ann.
Minister, I just want to get a clarification. I have one question for Dr. Mitchell and one for you. In terms of the 3 that are in isolation, what age bracket do they fall in? And for Dr. Mitchell, I just want you to give me a little clarification. On Monday, you said that you pending tests, and today we're saying we have 47. Could you clarify that 4, whether it was incorporated into this 47 that you mentioned?
No, I clarified on Monday that the pending tests were already reported on. So we had no pending tests as of Monday. I said that the pending tests were part of what I reported on. So that is clear. I don't know why there was ambiguity about it. And may I go ahead and the age group of persons that are currently at our facility are over 65, thereabouts. I don't have the average age per se, but we're certain, and I'm certain that they are all over 65 years old.
The general public would just like Minister Steele to guarantee them the route at which ventilators would be get Grenada based on news from what has been taking place within the United States. Not your ventilator, but whatever equipment we have coming in at this time.
Well, I think I've implied, and it would not be to the benefit of the public right now for me to clearly say what route they're taking, but just simply to say that we are making every effort based on the various disruptions, and that's what I will refer to them as, disruptions from traditional routes to get emergency cargo into Grenada. We have had to make other arrangements. Rest assured, those other arrangements are being made. I mentioned one of them earlier with respect to expressing our gratitude to the government of the Bolivarian Republic of Venezuela. But there are other avenues that are being taken. We are also grateful to the government of the People's Republic of China, as well as private individuals who have stepped up to assist us in getting our various items into Grenada.
Hello? I have several other questions. What are the drugs used to treat COVID-19 patients?
I'm not the doctor here, but I can safely say that the doctor is going to tell you it depends on the condition and the severity of the individual. But yeah, there are multiple drugs that we have been asked as a ministry to make sure that we have adequate quantities of, as well as you hearing on the internet and other sources of various other drugs that might be contemplated. But I think if at best maybe we can arrange to have one of our doctors who are doing the treatment, overseeing the treatment of those patients, to maybe give a little update on that as to what the drugs are. But first off, I think we would discuss as to whether there's a benefit in making that information public, because what we have seen happening in other countries, I really don't think it will happen here, but we always need to be cautious, is private individuals just going and grabbing up those medications where they aren't prescription, or even finding ways where they are prescription to keep for themselves, and that takes it out of circulation when we need. That won't be the case here, because as a government we have made sure that we have it in our formulary and at the hospital readily available. So there are a multitude of drugs, but you have heard some of them mentioned with respect to treating directly COVID-19 virus. And then there are the regular bits of types of medication that are used for upper respiratory tract. But Dr. Mitchell?
Yeah, let me expand a little bit. As I said before, our clinicians are extremely knowledgeable. Dr. Noel and the team up there, the nation, I think, have come to respect their clinical argument and judgment. And we have a treatment protocol. Now, that protocol is extended to persons on a more or less individual basis, depends on how severe they are, depends on if they have any what we call comorbidities, meaning if they have any other illnesses. So it's a flexible treatment management protocol that is extended per patient on an individualized basis. But Rachel, as Minister said, we would love for you to have a one-on-one with our very capable team of doctors at the hospital.
I have several other questions. Minister Steele, there are 52 Grenadians aboard a cruise ship that wants to come home. They have until the 15th to leave the cruise ship. What are government plans for them?
We've had significant discussions, and there are more than 52. There are quite a lot of Grenadians who would like to come home. We have closed the borders inward, except for medical personnel. We do look forward to being able to open up and allow our Grenadians who are outside there to come back home. What I would say publicly, though, to the best of my knowledge, the employer, i.e. the cruise ships, do have an obligation to return individuals to their home country or home port. I find it strange that they would just be telling them they have until the 15th and then what are they going to do? But we're working with them, and we would like to be able to accommodate. We are having discussions with respect to quarantine facilities to allow individuals slowly, to the best of our capacity, to get in. But I'm sure we would all agree as a nation, while we are making the sacrifice here now to make sure that we as best as possible become COVID-free, we have to be very careful to make sure that when we meet our obligation of dealing with our citizens and affording them the opportunity to come back home, that we do so in a very careful and methodical manner that allows us to still continue to remain COVID-free and not put the rest of us at risk.
All right, so colleagues, we are wrapping up at 5 o'clock, so we can't get everything in one time. As the minister said, they'll try to update us as often as possible, so we'll have to save some of your questions for the other time. But
we'll be back tomorrow because we have to give the results.
Yeah, exactly. So you have time. Okay, Junior George, are you there? Junior George, go ahead.
Yeah, I'm here. How are you doing, Minister? And of course, Dr. Mitchell, I hope you guys are doing well. My question to you is, we haven't seen Dr. Martin in quite a few days. Last time we saw him was after, I think the last time that, he contradicted a statement that was made as to the person who flee quarantine. Could you give us an update of Dr. Martin, and where is he?
Dr. Martin has not been incarcerated or abducted by aliens, anything like that. We spoke as recently as today, Dr. Martin and myself, but as you can imagine, everybody is quite busy. And I physically saw Dr. Martin yesterday, so I know he's in good health. So no, he's been working hard, as has all of the rest of our team in the Ministry of Health and at the General Hospital and GPF. You may not see all of us every day. You didn't see me for a couple of days, but that is nothing negative. It just means that we are working hard elsewhere.
Okay, Kenroy Batiste. All right, Kenroy doesn't have a mic. There was a question we had, let me see, 456. We had to ask quickly, have there been any recoveries from the 11 confirmed cases so far?
At the moment, no, there's nothing confirmed on that, while some of the 11 on island may have recovered or have had mild symptoms and then no symptoms right now. We're still going to wait a couple of days to a week or so before we test them. The protocol is to test them twice in 24 hours. If testing twice in 24 hours they show negative, then they would be deemed to have recovered. So we're still waiting for that. I think it's a bit premature for us to do that.
All Somebody else is asking, what is the monitoring protocol for the 47 whose test results are pending?
The monitoring protocol. Well, that would depend on the results. At the moment, they are quarantined. They are being checked on a regular basis by our teams at the district level, and we're ensuring with the measures outlined in the curfew that they are observing these measures out there and that they are where they're supposed to be. And that's basically it. We're ensuring that they are quarantined. I'm not sure if they're talking about surveillance, whether or not we have police on their cases. I will leave that to the commissioner. I don't know. This is a matter for us, whether it's to be said how it is done. I leave that to the COP, but just to say that we feel confident from where I sit that whereas we did have some issues some time ago with persons observing quarantine of late, we feel confident that those people have been observing their mandatory quarantine.
All right, so we're 2 minutes away from 5 colleagues. Unfortunately, we'll have to leave the other questions for tomorrow because the minister did say that we'll have an update tomorrow, God's willing. So I'll give you gentlemen an opportunity now to make some closing remarks.
Can we touch on that? Sensitive, oversensitive.
Yeah. 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 I think you're good.
Sorry?
Yeah, I think you're good.
Go ahead.
Okay, so Commissioner or Dr. Mitchell, you can go ahead.
Right. Let me close by thanking again our healthcare frontline staff, both at the level of the Ministry of Health, at the hospital, and at the community. Every single class of those workers. We really, I think the nation salutes you. We appreciate what you do. And we expect more and more of you to join that army in this historic response that we are actually having. And so when the annals, when the history of COVID-19 is written, that you can stick your hand up and say, I was part of this historic response. I want to also thank each and every person out there who have, in one way or the other, say thank you, guys. We're supporting what you do, and give advice as to how best we can do or respond or tailor the response in one way or the other. Those are really, 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 really. Some of them are actually great advice. We have actually taken on a lot of them, and so we really appreciate that kind of spirit. We have asked you to comment, and some of them, yes, a lot of people have come forward. So we want to thank each and every person out there. Thanks for your prayers, and let's hope that we can get through this together. As the Prime Minister said, we are all in this together. Thank you.
Yeah, thank you very much. I too would like to give my closing remarks by saying a special thank you to members of the public who are with the outpouring of recognition for the efforts of the RGPF in working in collaboration with other stakeholders in this fight. Certainly it means a lot to the RGPF, who have been working on a 24-hour basis shift system since the commencement of our formidable fight against the COVID-19 disease. And I must give special recognition here to some aspects of Cooperate Grenada, who has responded in supporting the RGPF. And I want to single out for recognition here GRENADAB, who has sponsored or provided $30,000 to assist with food and rations for the RGPF. Sagico Company, 5,000 US plus 10,000 EC. Digicel and Glenelg for providing water outside is hot and officers need to be sustained. a ton of gratitude and deeply appreciate your assistance in this regard, and on behalf of the force I say thank you. And again in closing, thank you to members of the force. The public recognize and appreciates what we are doing. I hope you will use that as motivation to continue to serve this country and its citizens until we eventually defeat this disease. Thank you.
Yes, let me, in closing, I want to address one item. I thought a question may have been asked on it, but with respect to banks and banking. Just before coming here, we were in discussions with the Grenada Bankers Association. We are able to confirm that the Bankers Association is saying that all government checks, any and all government checks, can be cashed at supermarkets, should the supermarkets so decide to do so. But they are assuring the supermarkets that government checks can be cashed at supermarkets. We are aggressively working with them on a modality that will allow for other checks. But as you can imagine, there are complications involved in this because there is a need to ensure that there are funds on the other side of that check in the multiple accounts that checks may be written on. So we are looking at a modality that would first allow for corporate checks, and then, if at all possible, to have a modality that would allow for other checks. But it is extremely difficult, but we will not rest until we are able to find some sort of solution with the Banking Association on that. They have chosen, and we cannot argue or fault them. They are private institutions. They have chosen to remain closed to the public for the safety of their own individual employees as well as the public at large, because anywhere or any institution that allows for congregation is also a risk for infection. But we do understand as a government that this has put severe challenges on individuals out there, and as a responsible government we will not rest until we've found a solution for everyone out there as best as possible. So that is with respect to the banking in Grenada. Similarly, we have had discussions with the credit unions in order to find some sort of modality that was as best as possible. The Banking Association assures us that all ATMs will be filled up on a regular basis, that they did have some challenges over the last couple of days, but they are working to make sure that those challenges no longer exist with respect to regular refilling of ATM machines, and that any and all checks can be deposited for those who have ATM cards into their accounts and would be available to them in a timely manner. What we have to work on is those individuals who do not have ATM cards, debit or credit cards, and need to access their accounts in those individual banks. And I've said we've put a team together, including myself and others, Minister Emlyn Pear, as well as Anthony Boson, and others, working with the Banking Association to make sure that we can find some sort of modality that works for us all wherever possible. In the interim, we are going to have to rely on the principle of being a brother's keeper and neighbors looking after neighbors, where we know one of our neighbors has a challenge with respect to getting cash or access to cash. So in closing, again, I want to as well say that taking this opportunity to express my sincere gratitude to the team at the Ministry of Health, in particular the team of healthcare workers who have been working, putting themselves at risk and working to alleviate the pain and discomfort of those who have tested positive, as well as, because remember, as well as other individuals who continue to need health care access. So they really have been stepping up to the challenge under the conditions, and I want to congratulate them as well as thank them and encourage members of the public to find ways to express their gratitude to these individuals and the sacrifice they continue to make. The RGPF, the Commissioner himself for the Yeoman Service and his team in being able to facilitate, but also, I think more importantly, you got to recognize in being able to maintain order as best as possible while making sure that they put themselves at minimum risk. But we do have to acknowledge that in their efforts to maintain order, they are putting themselves at risk. But they serve, and therefore they've been doing that. Everyone else who has assisted us, there is a team that has helped to get that facility up and running. The management at the General Hospital, Dr. McIntosh, Dr. Donald, Dr. Dolan Noel, who has assisted, and the nurses, Sister Honoris, all of our nurses there, as well as courts assisted us, and Hubbards with additional small items that we needed there. St. George's University continues to provide yeoman service to us, as well as WinRef and CARFA. A Canadian bank note has come to our assistance in providing logistical support and equipment. Government and people of the People's Republic of China, government and people of Bolivarian Republic of Venezuela, and most definitely the government and people of Cuba, or Cuban nurses and doctors who are here on the front lines with us when they could and should have been back home looking after their own country. And our network of ambassadors, high commissioners, and friends of Grenada out there who have been assisting us with getting items in and purchasing those items for us in many cases and sending them to us. So I want to thank the entire team, Dr. Charles, Dr. Martin, who have been working to make sure that this situation that we're in now is as positive as we are seeing it now. All of the contact tracing, all of the tests, making sure that those get done. There are a lot of individuals who've been working behind the scenes to make sure this happens. You're seeing some of us in the public, but there are many, many who have been working behind the scenes that I do look forward to the day when we can all gather and give thanks to them and give praise to the Almighty that we have gotten through this.
Thank you very much, Honorable Minister. So we've ended for today. So thank you, Minister. Also thank you to the Acting Commissioner of Police, Edvin Martin, and Dr. George Mitchell, the COVID-19 response
I have
coordinator.
one update. I just saw it on that survey that's going around. Yeah. There are two surveys in circulation. One is by SGU School of Public Health, where they are lending assistance and trying to gather information. And the other is a private individual who is gathering the information, I'm assuming to assist us, but neither of those surveys are officially the Ministry of Health. The St. George's University, I know we work hand in hand with them, and the other individual, their name, I've been given their name, and I know that they have been working with us too, but the Ministry of Health survey is not out as yet.
Thank you very much. So before we wrap up, let me just remind you of the shopping days on Saturday and Sunday. And of course, you're going in order of surname. So on Saturday, April 11th, 8 a.m. to 12 noon, those with the surnames beginning A to M. And then 1 p.m. to 5 p.m., those with the surnames beginning N to Z. On Sunday, April 12th, 8 a.m. to 12 noon, we'll switch it around. So those with surnames beginning N to Z will shop first, and those with the surnames A to M will have the opportunity to shop from 1 p.m. to 5 p.m. and of course a photo ID is needed. So just let us all just do what we have to do and ensure that we take our times and just ensure that everything goes according to plan and we obey the rules and just follow all the rules and regulations so that the process will go smoothly. Here's where we end for today. But as the Honourable Minister mentioned, we are going to be back here tomorrow, God's willing, to update you once again. So colleagues, for all of you who still have questions, we'll get those in hopefully tomorrow. I'm Leslie Johnson. Thank you so much.
Protect yourself and our community from COVID-19. Wash your hands frequently with soap and water for at least 20 seconds. If soap and water are not available, use an alcohol-based hand sanitizer with at least 70% alcohol. Use a tissue when blowing your nose, sneezing, or coughing. Immediately discard the tissue properly and wash or sanitize your hands. Avoid close contact with people who are sick. Let's do our part to ensure that each and every Grenadian remains healthy. To stay up to date, visit the Government of Grenada's webpage or the Ministry of Health's Facebook page. For more information, contact the Ministry of Health's hotline by calling 53-VIRUS. This has been a public service announcement brought to you by the Ministry of Health.